My name is Cindy Garzón Lavalle, and I'm going to talking about Clopidogrel and Aspirin in acute ischemic stroke and high-risk TIA. Definition: from head to toe, your blood delivers oxygen to every part of your body. Your cells need it to survive. If your blood flow gets blocked anywhere, it can bring big trouble. One serious effect is a problem called a transient ischemic attack, or TIA for short.
Primary prevention of stroke requires the management of atherosclerotic risk factors, such as hypertension, diabetes, smoking, and dyslipidemia. As the risk increases, secondary stroke prevention factors include identifying whether or not the patient has suffered from prior transient ischemic attack, stroke, coronary artery disease, peripheral vascular disease, asymptomatic carotid stenosis, or atrial fibrillation. All patients with ischemic stroke or transient ischemic attack should be on antiplatelet therapy or ASA for secondary prevention of recurrent stroke unless there is an indication for anticoagulation or a contraindication to ASA. Anticoagulation long-term with warfarin is the superior antithrombotic if atrial fibrillation or other definite cardiac source of embolism is identified as the cause of stroke or TIA. Surgical intervention is very effective in the prevention of stroke in symptomatic severe internal carotid artery stenosis. Earlier intervention yields greatest benefit.
Ischemic stroke. Ischemic stroke is characterized by the sudden loss of blood circulation to an area of the brain, resulting in a corresponding loss of neurologic function. Acute ischemic stroke is caused by thrombotic or embolic occlusion of a cerebral artery and is more common than hemorrhagic stroke. Transient ischemic attack, or TIA, meaning stroke, a neurological event with the signs and symptoms of a stroke, but, but which go away within a short period of time, also called a mini stroke. A TIA is due to a temporary lack of adequate blood and oxygen ischemia to the brain. This is often caused by the narrowing or less often ulceration of the carotid arteries, the major arteries in the neck that supply blood to the brain. TIAs typically last 2 to 30 minutes and can produce problems with vision, dizziness, weakness, or trouble speaking. If not treated, there is a high risk of having a major stroke in the near future. Applications in medicine. Combination antiplatelet therapy with clopidogrel and aspirin may reduce the rate of recurrent stroke during the first 3 months after a minor ischemic stroke or transient ischemic attack. TIA
Following a stroke, you may be prescribed an antiplatelet drug such as aspirin or Plavix. In this video, we'll talk about antiplatelets and cover the types of antiplatelet medications that are used to prevent stroke, how antiplatelet medications can reduce stroke, and possible side effects of antiplatelet medications. Antiplatelet medications reduce your chance of having a blood clot by preventing the platelets in your body from clumping together. Taking antiplatelet medications can reduce your stroke risk by 25%. There are 3 antiplatelet medications commonly used today, and they all work equally well. The first is acetylsalicylic acid. This is also called ASA or aspirin. Second is Clopidogrel, also called Plavix. And the third is ASA combined with another medication called dipyridamole. This combination is also called Agranox. Antiplatelet medications are usually well tolerated. Some people experience an upset stomach while taking these medications. The medications can cause you to bruise more than usual, and they can also increase your risk of bleeding. Talk to your doctor, your Lake Ridge Health pharmacist, or another member of your healthcare team if you experience side effects or if you have any questions about antiplatelet medication or any other drug you are taking.
A trial of combination antiplatelet therapy in a Chinese population has shown a reduction in the risk of recurring stroke. We tested this combination in an international population. Applications. Aspirin has proven benefits in primary and secondary prevention of coronary artery disease. Clopidogrel, an alternative antiplatelet agent used in patients with aspirin intolerance, is especially useful in combination with aspirin after coronary stent procedure. Pros.
Hello, everybody. I'm Dr. Li Pingyu from Beijing Tiantan Hospital, Capital Medical University. And Beijing Tiantan Stroke Center is really the largest institute on neuroscience, especially on cerebrovascular disease. So we are taking the leading position in China either for the clinical practice and clinical research. Today, I'm going to give the presentation of the readout of the large RCT trans trial and one of the subgroup analysis of the intracranial artery stenosis. So everybody knows the ICAS by arthro is really common causes of stroke in China and higher burden of stroke in Chinese patients. So the how to treatment and how to management the risk factor is really significant. So the results from the subgroup analysis indicate the combination of the clopidogrel and aspirin treatment will be get a chance to better reduction of the recurrent stroke at 90 days. But there is still not a significant difference. The reason why is might be of very small sample size. But on the other hand, if we take a look at the interaction of the two treatment group or those with or without ICAS, there's no significant difference as well. So it indicates we might be having a potential prescription of the combination for either acute minor stroke and TIA with ICAS population, but still need further clinical research in the future. And this is really the great opportunity to present the results and to show what the research coming out from China or other Asia area. And it's really a great pleasure for me to represent the Tiantan medical centers. Thank you all for all the support and the organization, and really nice meeting here. Thank you very much.
drugs used to prevent blood clots, reduce fever, and to treat pain and inflammation in the body, reduce the risk of a stroke and heart attacks. Cons.
This information is provided for public education purposes only and is not intended to substitute for a manufacturer's directions or consultation with a licensed pharmacist or healthcare professional. All medication, including those available over the counter, can be harmful if not used as directed, and taking more than one medication could result in harmful drug interactions. Please consult a licensed pharmacist or healthcare professional before taking any medication or changing an already approved or prescribed medication plan.
Hello, my name is Emily. I'm a student pharmacist at the University of Arkansas for Medical Sciences. Today I'm here to talk to you about your medication, dipyridamole plus aspirin. Dipyridamole plus aspirin is also known as the brand name Agrinox. Agrinox comes in the capsule dosage form and is most commonly used to prevent strokes in patients who have had a stroke or are at risk of having a stroke. Agrinox may also be used as an alternative therapy for intolerable headaches. Agrinox is usually taken by mouth and is safe to take with food or on an empty stomach. Some common side effects of Agrinox are headache, nausea, and diarrhea. Some less common side effects of Agrinox are tiredness, nosebleeds, back pain, and vomiting. Do not take Agrinox if you have an allergy to non-steroidal anti-inflammatory drugs. While taking Agrinox, remember it is important to tell your doctor or pharmacist if you have signs of an allergic reaction like rash, hives, or itching, signs of bleeding like throwing up blood or bleeding while brushing your teeth, chest pain or pressure, changes in color of your skin, a heartbeat that does not feel normal, or ringing in the ears. Thank you for watching, and if you have any other questions, please contact your pharmacist or healthcare provider.
This information is provided for public education purposes only and is not intended to substitute for a manufacturer's directions or consultation with a licensed pharmacist or healthcare professional. All medication, including those available over the counter, can be harmful if not used as directed, and taking more than one medication could result in harmful drug interactions. Please consult a licensed pharmacist or healthcare professional before taking any medication or changing an already approved or prescribed medication plan.
There is a potential for significant bleeding complications from the synergistic antiplatelet effect. Effects include abdominal pain, burning sensation, cramping, liver damage, or fatigue. Issued a plea in Ecuador. Stroke and cardiovascular disease will be the next health epidemic in Latin America due to increased life expectancy and changes in the lifestyle and dietary habits of the population. Knowledge of the cardiovascular health status of the inhabitants will allow the implementation of policy directed to reduce the burden of stroke and cardiovascular disease in the region. The primary objective is to raise awareness of the problem. Neurological catastrophes, ischemic stroke, brain hemorrhages, and traumatic brain injuries are among the four most common causes of death and disability in Ecuador. Meanwhile, in countries like the United States, they celebrate because they managed to reduce stroke from the third to fourth leading cause of death. In our country, the situation is becoming more serious. Conclusion: I think that in patients with minor ischemic stroke or high-risk TAI. Conclusion. I think that in patients with minor ischemic stroke or high-risk TIA, thus who received a combination of Clopidogrel and Aspirin, had a lower risk of major ischemic events, but a higher risk of major hemorrhage at 90 days than those who received aspirin alone.
A stroke is a medical emergency. Strokes happen when blood flow to your brain stops. Within minutes, brain cells begin to die. There are two kinds of stroke. The more common kind, called ischemic stroke, is caused by a blood clot that blocks or plugs a blood vessel in the brain. The other kind, called hemorrhagic stroke, is caused by a blood vessel that breaks and bleeds into the brain. Mini strokes, or transient ischemic attacks, TIAs, occur when the blood supply to the brain is briefly interrupted.
Symptoms of stroke are sudden numbness or weakness of the face, arm or leg, especially on one side of the body. Sudden confusion, trouble speaking or understanding speech. Sudden trouble seeing in one or both eyes. Sudden trouble walking, dizziness, loss of balance or coordination. Sudden severe headache with no known cause.
If you have any of these symptoms, you must get to a hospital quickly to begin treatment. Acute stroke therapies try to stop a stroke while it is happening by quickly dissolving the blood clot or by stopping the bleeding. Post-stroke rehabilitation helps individuals overcome disabilities that result from stroke damage. Drug therapy with blood thinners is the most common treatment for stroke.